It's nice to be here in Uppsala. Actually, one of my big secrets is I was born in Uppsala, and I lived actually at Götgatan 3, which you can see literally out the window over there across the Fridhusån. So I'm a very close. I was trying to scope out this hotel yesterday because I was living somewhere else. I walked by and said, hang on, I recognize this part of the world. I'm from here. And I crossed the river, and I went and sat in this playground where I was there when I was 5. How cool was that? And it's just across the road from here. So it's great to be back in Uppsala, especially so close to my own little home, if you will. So I'm a risk communication guy, and today I will give you a taster in the area of risk perception and communication. I've been interested in the whole field of risk communication since the Chernobyl accident in 1986. I'm an old guy, I'm going bald. And I should clarify, I was born in Uppsala, but basically I grew up in California. I grew up in Los Angeles, did my undergraduate at UCLA, MA and PhD at Clark University in Boston, and then I also had been educated and worked at IASA, at the International Institute for Applied Systems Analysis near Vienna, Austria. I'm also adjunct faculty at Carnegie Mellon University, Harvard, Gothenburg. So I give a talk on average about twice or 3 times a week. This is the 3rd one this week, and I have 4 more to go Thursday, Friday. It's going to be a busy week for Ragnar. Hope you like it. So what am I going to talk about today is as follows. Provide a definition of risk perception and communication and put it into context with examples. A. B. Discuss why risk communication is important for the pharmaceutical sector. And C. Offer some possible solutions going forward. Now, I've been told by the organizers that you guys are a talkative bunch. Is that right? No. You're not telling me the truth. I think you are. And that's very good because I was trained in the US, so I don't like talking for 3.5 hours. I'd be bored, stiffless to do that. So I'm going to be asking you questions throughout. Is that okay? Thank goodness. So let's get started then. So basically, to understand the whole area of risk perception and communication, we need to understand the importance of heuristics and biases. Heuristics and biases are so-called mental shortcuts. So the first homework assignment for you is basically you should all read, if you haven't, the excellent book by Daniel Kahneman called Thinking Fast and Slow. Has anybody read that book? Thinking Fast. You can buy it in the bookstore just down the road. Just go in. The bookstore is still there when I was a kid. I went there yesterday, and the book is in the bookstore. It's called Thinking Fast and Slow, and the author is Kahneman. Kahneman is a Nobel Prize winner in behavioral economics circa 2002. It's an excellent book, and you should buy it this afternoon. You can have it as a bedtime reading tonight. Or you can also read it on Saturday, unless you go to the tour of Stockholm. And Sunday you have a free day. You can spend the whole day reading it. So what Mr. Kahneman found there are a number of different so-called heuristics and biases. One is the so-called anchoring effect. The anchoring effect occurs when people consider a particular value for an unknown quantity before estimating that quantity. So let me give you 2 examples at least. One, for example, if you're asked, how old was Gandhi when he died? Was he more than 114 years of age? If I say 114, give or take a few years, your number will be, say, anchor's 114. I'll say probably died at age 95. If I said basically, was Gandhi younger or older than 35? Will you say 85 then? No, you'll go much lower. You'll go 40 or 50. It's a so-called anchor. We're all bound to anchors. Another example, classic example, is from the Museum of Fine Art in Boston. Has anybody been to the Museum of Fine Art in Boston? You haven't read Kahneman, and you haven't been to the Museum of Fine Art. Well, you should go. When you're in Boston next time, go to it. And basically there at the Museum of Fine Art in Boston, once a month on a Wednesday evening between 5 p.m. to 9 p.m., basically, the museum was free of charge. People could come with their families and see the beautiful Singer Sargent paintings and the like. And the museum felt they had a good conscience about that. But they also had a thing, basically, it's free of charge, but it's still of cost, right? You still have energy costs, you have lightning costs, you have security costs and the like. So people are saying, hang on, we need to get some money in because we're losing so much money this evening. So they put basically donations box, please donate something. And how much did folks donate, you think? Nothing. They took out the change, called them shrapnel in American English. Let's give some shrapnel, so nickels, dimes, quarters, right? Not much at all. And we're realizing we're still getting, quote unquote, more or less nothing. This is simply not good enough. So then he said, this is not going to work. We gotta put in an anchor. So they said basically, suggested donation $20. And then what happened? What happened then? People started giving $20 bills. And then the museum was happy, right? Makes sense? Similarly, another example comes from Minneapolis, Minnesota, where Coke was doing a campaign to trying to sell more cans, more of this sugary stuff you shouldn't be drinking, right? And they were saying basically, we suggest 50% off on Coke and basically buy as many you want to. So people then, rather than buying 1 can of Coke, they bought 2 cans or 3 cans or 4 cans, right? And they were not shifting enough cans of Coke. Our friends in Atlanta, Georgia were upset. We gotta shift more. We have a surplus of Coke in Minneapolis. So they said basically 50% off, but limit yourself to a dozen cans of Coke. The anchor changes. And what happened? People started going off cartloads of Coke. It's playing basically, it's a typical marketing trick, and it works. And who invented it? Daniel Kahneman, the so-called anchoring effect. Another example coming out of his work is the so-called simplifying heuristic. And here I'm going to give you a quote. An individual has been described by a neighbor as follows. Steve is a very shy and withdrawn, invariably helpful, but with little interest in people or in the world of reality. A meek and tidy soul. He has a need for order and structure and a passion for detail. End of quote. Is Steve, this is not in the US, is Steve more likely to be a librarian or a farmer? Hands up for librarian. The whole class is going to say, the guy is a fruitcake, he's a doink, okay? He's hanging out in libraries, of course. He's a meek and tidy soul. The guy's not basically a normal human being, right? He's a wimp, right? The guy is a librarian. Wouldn't you think so? Of course we think he's a librarian. Ha! And everybody, when you do this test, and Kahneman, he's been a professor at Stanford and Princeton and University of British Columbia and Berkeley and so on and so forth. 80% of undergraduates says, oh, duh, the guy's a wimp, he's a librarian. There are 20 times more male farmers than librarians in the United States. Therefore, most likely, this wimp is actually a farmer. Well, there you go. Probably a farmer with a bunch of pigs or something. I don't know, bless his little socks. But basically, and that's another important issue, the so-called simplifying heuristic. The third one is the so-called availability heuristic. We are all affected by the media, so-called available information. So a question for you. In the United States, do we have more suicides or more homicides, murders? Hands up for suicides. Okay, hands up for murders. So most of the time when I give this talk, people are going to say what? By far, murders. Why? It's all you hear about. It's like this mass killing people, shooting kids. They're shooting basically some big, motor gang thing in Texas the other day. Was it 9 dead or something? 200 arrested. They all have machine guns in the United States. They all kill each other, right? But in actual fact, there are more suicides. But people in the United States, the media does not talk about suicides. So basically, the media in the United States have a policy. We don't want to talk about suicides because of what? They are worried about copycat suicides. So, trivial pursuit question for you. The most popular place to kill yourself in the United States is where? Golden Gate Bridge, San Francisco. Very good. Golden Gate Bridge, San Francisco. He knows it. He got it. So basically, if you have an article in the San Francisco Chronicle saying basically Joe Bloggs jumped himself off the Golden Gate Bridge in San Francisco, what's going to happen the next day? You have 3 days, 3 folks jumping. A week later, you have 10, and then a month later, it's 2,000 people, group jump, all dying. That's so-called basically, that's what happens basically. People are worried about that. So suicides are not discussed in the United States. And that's something I'll question for you. Is suicides discussed in your home markets? For example, I'm Swedish, but I grew up in California, but I now live in London. I'm a very complicated mongrel. And basically in the UK, in some cases, suicides are discussed. And for me, that worries me an awful lot. My most famous example was in South Wales. South Wales is a very poor part of the UK. And basically you have there, it's primarily a coal mining area. What happened there, you had a girl basically hanging herself in her bedroom. It was a teenager. Teenagers are all trouble. I have not only one, I have a 20-year-old and a 17-year-old. And teenagers, trust me, both daughters, they can be quite a bit of handful, put it that way. But we're still very loving individuals, of course. And what happened was this one teenager girl killed herself in South Wales. And then some stupid fruitcake journalist decided, what's this a story? And discussed this girl killing herself and how she did it by hanging herself in the bedroom. And what do you think happened in South Wales? You had now all of a sudden a cluster of suicides among teenage girls in South Wales. That, my friends, is something, as we are parents, should be very worried about. And if you know your journalist friends somewhere where you're all from in the world, please tell your journalist friends, don't discuss suicides. We don't want to have our kids worried about this, do we? They have enough things to worry about. When they're growing up, their hormones are going crazy. They shouldn't think about suicide. So please tell your journalist friends that. And that's what I do. I was very angry about this, and I would tell you BBC and Wall Street Journal, National Times, every time since, you should be ashamed of yourselves if you discuss suicides. We don't want to have suicides. Another thing on availability heuristic, which I find very interesting as a Swede, so when I go to dinner parties in London, and the folks in London, they think Swedes have two things in common. A, they all commit suicide, A, and B, there are tons of murders in Sweden, tons of them. And of course, the reason for that is, for example, the Swedish author Henning Mankell and the Wallander stories about some guy basically in whatever it's Ystad, right, in southern Sweden, and basically he goes around solving all these murders. And there are less murders in Sweden than there are basically in Los Angeles by a factor of 4 or something. There are not that many murders here in Sweden, trust me. You'll be safe walking this evening, all right? And the further point is understanding base rates. Big samples are better than small samples. So if you see a sample size of 12 in a newspaper, don't really believe it. If you see a sample of 10,000, that's more likely to believe. And finally, the so-called hindsight bias. We know it all along effect. Typical example, 2 examples here. The bombing of Pearl Harbor, right? 1941, I believe it was. And what happened is basically, after that happened, there is some conspiracy theories saying, oh, Roosevelt knew about the Japanese bombing Pearl Harbor. He wanted the Japanese to bomb Pearl Harbor because he wanted to go to war against Germany, right? But, it's simply not true. Hindsight bias. Another example, the 9/11 attacks on New York City, right? There's a lot of rumors there basically is that FBI and CIA wanted to have those attacks so they could get bigger budgets and set up the Department of Homeland Security, okay? So I gave this talk at Harvard, at Kennedy School of Government a couple of years ago, and the room was stuffed with what? CIA folks, Secret Service folks, and generals and lieutenant colonels, okay? We had a room of 80 people. And I raised this question in class, and I raised it after 4 glasses of wine, not me, them, 4 glasses of wine in the evening, find out, is there any truth to this? And you know what they said? Categorically, when they were both sober as well as half drunk, there's no truth to it whatsoever. Frankly, I tend to believe them. Furthermore, the work of Tversky Kahneman influenced the work of Brooke Fischoff from Carnegie Mellon University, Paul Slovic from Decision Search, and Sarah Lichtenstein from Decision Search. There's a number of others, people like Ortwin Wren and myself. And basically here is a good book, since I'm being a professor today, I can do this. The next book you can buy is basically The Perception of Risk. Perception of Risk, and that is by Paul Slovic. 2002, it's 2 books, 2000 and 2010. And what he found basically is that people view risks differently. First, we have natural and technological hazards. People basically are more concerned about what? Tell me. Natural, technological, what are people more worried about? It's interesting. People are more worried about technological hazards than natural ones. Tech hazards are seen to be an act of human. There is someone to blame. Natural hazards are seen to be acts of God. Thank you. There's no one to blame. Natural seem to be natural. And basically, for example, I think the Swedes are worried about snow. No, it's so bloody cold. Can I say bloody in this? I probably shouldn't. I'm sort of filmed. I can't use that word. It's so cold. And I was surprised how cold it was like the last couple of days. I was telling my wife it was +3 Celsius the other night. It's ridiculous. It's really cold for May. And so basically, Swedes can adopt to snow, right? How about the folks in California? Can the folks in California adopt to earthquakes? Of course we can. We grew up with earthquakes. People accept them. And in many cases, we see, especially in the States, people basically go out and seek natural hazards. So when I was basically doing my PhD at Clark University, we had basically undergraduates coming to me and saying, Ragnar, I know you want to teach us tomorrow, but we're all going to cut class. I said, why? Well, there's a hurricane coming into the Florida Keys. We're flying down to Miami. I said, why would you not going to fly? Why are you going there? Oh, right, no, you don't understand. You're Swedish, you see. So we go to the Florida, we go to Miami, and then we're going to rent a car, go out to the Keys, and we're going to rent in the flat. Then we're going to buy 3 bottles of rum, or 10 of them. Then we're going to basically party the hurricane when the hurricane comes in. So you have a hurricane party. I said, yeah, Ragnar, like, duh. I was like, I've never heard of this, hurricane parties. And the similar things, think about it. Similar things, if you ever go to the States and you're jet lagged and get up at 5 in the morning, put on the Weather Channel. That's what I did. I was in the States 2 weeks ago. I was in New York. And basically what happened there, you have people chasing basically tornadoes, tornado chasers. They were filming these tornadoes and they drive them, look, this awesome tornado coming at you. That's insane. I would never chase a tornado. But people obviously do. And the opposite, you think. So what do you think happened when you had the 3 Mile Island nuclear power plant accident in Harrisburg, Pennsylvania in 1979? Did people go and say, hey, let's party a nuclear power plant accident? You think that happened? No, it did not happen. What happened was basically, this on a local radio, we suggest that all pregnant women within a radius of 15 miles of this plant should evacuate. What do you think happened? Everybody tried to evacuate, which meant that no one did because the roads got stuck. So overall, people worry much more about tech hazards than natural ones. But there are, of course, exceptions. If you take somebody out of their environment they're from. Now, case in point was a couple of years ago, we had a Swedish journalist, we'll call him Gustav. His name was not Gustav, let's call him Gustav. Gustav called me up, he's a friend for many years. He said, Ragnar, yes, you're a professor of risk management, aren't you? I said, last time I looked, I said so. But Ragnar, I'm thinking of going to this energy conference in Kyoto, Japan. But I'm worried about dying in an earthquake, he said. What are the chances of me dying in an earthquake if I go to Japan for 3 days? And do we have Japanese in the room, by the way? Japanese in the room? Okay, there you go. So you know that the answer to that is very, very low. It's virtually infinitesimal. If for 3 days, you're not going to die in an earthquake in Japan. So I said, basically, I don't know the exact number. I haven't done the statistics on earthquake risks in Japan. But I can tell you it's peanuts. It's virtually nil. It's not totally nil, but it's very small. But Ragnar, I'm still worried. I'm married, I have 3 kids. I don't know what to do. I said, listen, I just told you the risks are tiny. You're going to be fine. But my kids, I said, oh, bloody hell, Gustav. Why don't you just go out there and get some, earthquake travel insurance coverage. So if you die, your family gets, 10 million Swedish crowns or something. And you know what? That's what he did. He got earthquake insurance. So if you take somebody out of their comfortable environment, put them somewhere else, then people are more worried about that, which is, of course, makes sense, right? You're not really used to it. It's like taking basically, having snow in the UK. Can the Brits cope with snow, you think? They're clueless. They're clueless. I was there a couple of years ago, and basically we had this much snow, basically 20 centimeters of snow or something, came and dumped in 24 hours. Heathrow Airport was closed for a week. Can you believe that? They couldn't open it. If that in Arlanda here in Stockholm, the airport would be open the same day from 10 minutes. The Swedes get it. And our friends basically at Heathrow certainly didn't. Another important fact, is this interesting, by the way? You guys enjoying this? Thank goodness, I'm happy I'm here then. We like that. So the next important factor is always show voluntary, involuntary risk, okay? People worry about involuntary risks much more, by a factor of 1,000 to 1. People are frightened of involuntary risks. But voluntary ones we accept. For example, how many of you are skiers? This is a difficult audience. No skiers in this room? Oh, we have 1, 2, 3, 4. Okay, fine. So what do you guys go skiing for? This is fun. Do you worry about the risks of skiing? Not really. But you get a thrill out of skiing, don't you? So another question for you guys then. So what do you think are the risks if you are non-Swiss and you're skiing in Zermatt, Switzerland, and you're skiing for 10 days or less per year? What's the risk of you ending up in a hospital with a broken leg, broken arm, broken finger, torn ACL or something? What do you think is the risk percentage-wise? You guess. It's not a test question. 1%? Anybody else? Less than 1%. You're scared. Anybody else? when I gave this talk to the Irish Insurance Association, I got numbers from 0.5% to 40. I can tell you, it was a 40% chance of breaking a leg. I would never ski in my life, right? It's a very high number. So what happened is, why do you think I asked this question? You'll see. So basically, I was in Zermatt, Switzerland, and I was skiing there back, and that must have been 8 years ago now. And I went down a very simple blue run, and my right binding on my skis released. It was rental skis, never have rental skis. I flew up in the air, and I put my 102 kilos on my right leg and broke it in 4 places, okay? Not to be recommended, okay? Breaking a leg in 4 places, I screamed. I went through childbirth, although my male, okay? It was very, very painful. It was not, and I knew it was broken. I felt the bones off. I tore the fibula off the tibia. It was really painful, and I cracked. I basically have got 7 pins in it, and I got a big bolt to screw it all in. It was pretty messy. So they took me down to the local hospital in Visp, it's called. And thank goodness it was in Switzerland. I didn't break it basically anywhere else. And Swiss healthcare, as you all know, is actually excellent, probably the best in Europe. And I went there, and at the worst night of my life, because I broke it in the afternoon, and the surgeons had gone home for the day, and they couldn't basically give me any morphine because they were worried I was going to tear off my Achilles tendon as well. So I was in the night, had my ice leg up high for 10 hours. It was a lot of fun. So basically, when I was there, I was really bored, right? My brain always thinks. I didn't have my laptop with me, didn't have any books with me. All I had was a phone and a pen and paper, basically, I got from the hospital. So when I was there for those 5 days, I started calculating, what is the risk of coming down here, to this hospital? And then basically, so thank goodness I speak German, so I was asking the surgeons, must think I was a big pain in the butt. I was asking the surgeons and the nurses and even the cleaners. And turned out everybody in that hospital in Visp that week in February were foreigners, okay? But not a single Swiss person in that hospital at all, firstly. Second point, they were not any kind of foreigners. Well, the Austrians ski in Saint Anton, and basically the French go to Val d'Isère, obviously. So there were none of these Alpine folks there, okay? So basically they were all flatlanders. They were like Irish, hello. They were Brits, and they were Danes, and they were Dutch, and there were occasional southern Swedes like myself. So they were all flatlanders. And the average, so basically I calculated the number of people skiing in Zermatt and the people in the hospital, and the number I got for that week was 2.4%. But don't reference Löfstedt 2015. This is not a proper peer-reviewed study, but 2.4% is not that big. But if you do an ad hoc risk analysis, which you should never supposed to do, so I was a very naughty boy, is that I was at that time in the 40s, I'm 51 now, so I skied half my life. So you do basically ad hoc risk analysis, 2.4% times 21 years. Well, you're asking for it, right? You're asking to breaking your leg. Have I skied since? I skied once. I went back to the same hill in Zermatt to make peace with the hill, to basically to have a proper dream about it afterwards, because I had horrible dreams for the whole year between breaking and I went back. But not since. I don't enjoy it anymore, because I'm now frightened of it, right? Which makes sense, is once you have done something like that, then you have so-called pessimistic bias. Is once you have broken your leg, you don't have that same enjoyment, because you know how breaking a leg feels, right? But most of us have so-called optimistic bias. We're programmed to be optimists, therefore we drink and we smoke, because we're thinking basically, I can drink a bottle of whiskey a day, my liver is going to be fine because I have a Swedish liver. And if I want to smoke basically 2 packs of cigarettes a day, I'm fine. I won't get lung cancer or stroke because I have very special lungs because I'm born in Gatan 3. I'm totally fine, right? But it's simply not true. My biggest optimistic bias is what? I'm a lumberjack. I've spent my Easter 10 days in Sweden cutting down trees with a chainsaw. Is that completely crazy? Well, of course it is. It's the biggest risk, basically, of injury among all blue-collar workers in Scandinavia is being a lumberjack. Especially a part-time, overweight Swedish professor, that you're bound to have problems. But you know what? I still love doing it. So the whole issue of voluntary and involuntary risk, and the final point on that is basically, with regard to phones and mobile telephone base stations, the phones are voluntary. You all have phones. You don't worry about the phones at all, do you? Because they're voluntary. But the mobile telephone base stations, where you have the signals going to your phone, you worry about that. It's involuntary. You hate it. It's going to radiate your room and going to zap your kids, right? But the risks are in the phone. They're small. They're not in those base stations. Another important issue is the whole issue of familiar vis-a-vis non-familiar risk. We're much more worried about what? Non-familiar risks. Of course, we're frightened of the unknown. We hate the issue of unknown. So a typical example, if you look at it, is so-called rare diseases. For example, the H1N1 flu, bird flu, and the likes. How was bird flu and H1N1 flu communicated in your countries? Bad or good? Very high, but too much, very amplified, very amplified. Thank you. So I was pretty much involved actually in the UK bird flu one, which took place a number of years ago. I'd basically been advising our friends in Brussels. I travel every week somewhere. And I'd kind of give you now a story, a Ragnar story. And I came back in the evening after being in Brussels, and I'm married, I have 2 daughters, live by the tennis courts in Wimbledon, and in London. And my oldest daughter was crying, so my wife was cooking dinner for the younger one, and I ran upstairs. And she was screaming her head off, and I said, "Sweetheart, what's the matter with you?" I said to her. "Hey, Papa, I'm worried about dying," she says. I was like, "Oh, bloody hell, it's getting younger and younger. These kids, I don't know. They're worried about dying. But Papa, but why are you going to worry about dying for? But I'm going to die from bird flu," she says. "Dying from bird flu? But why would you die from bird flu?" I ask her. I say, "Papa, look, I have a bird turd on my window," she says. Oh, and I look at her and I say, "Sweetheart, you're not going to die of bird flu." And then I pick on some country. No offense to anybody in the room, okay? Don't get wrong, angry now. And I pick like Vietnam or something. So the only way you can get bird flu is that if you spend basically 6 months in Vietnam and you sleep with 5,000 ducks every single night, then you might get bird flu. Otherwise, you won't not get bird flu. You won't get bird flu here in SW19 London. And then she looked at me and she pointed at me and said, "Papa, are you sure?" I said, "I am positive. I'm a professor of risk management. Good night." And it worked, right? She fell asleep. She was happy. And I went downstairs and was thinking, what on earth is happening here? Why is my daughter frightened, dying of bird flu? And it turned out that the chief medical officer had gone on television and said, "It's not a question of if, but when. We will have 50,000 people dead of bird flu in the UK." That's a big number, right? And I was thinking, this cannot be. I mean, what a fruitcake. How can you say this? It's complete nonsense. There's no evidence for this. So what happened was the next day, I did 2 things. A, I decided to call around various local GP practices in London to find out, had anybody called about bird flu? And it turned out, I called a few people, and I say who I am, and they say, "Oh, you have no idea, Professor. We've been inundated by phone calls on bird flu." So who's calling? Old age pensioners. Well, they have time on their hands. So what are these old age pensioners saying? They're saying 3 things. A, they're saying basically they want some medicine against bird flu, like Tamiflu or something. A. B, they're saying, "I want a vaccination against bird flu." And C, they're saying, "I have bird flu." And I realized this is not good. So I decided basically to contact the head of communications for the UK government, Sir Howard. And I say, I use all my various titles. I mention Harvard, of course, and Carnegie Mellon, and that I'm an expert advisor to so and so and so and so and so and so. And I tell Sir Howard, "I want to see you now." So I cut my appointments, and Sir Howard realizes I'm pretty stressed and pretty tense, and I can be quite persuasive when I want to. Decides to see me. So I go there to his room in the Cabinet Office in Whitehall in London, Westminster. And you know how you go into a meeting and there's so many negative vibes there? This was like one of those meetings. The guy, they were all like there, arms crossed, like staring at me like some kind of, Martian from outer space, right? And they said, "Yes, point, sit there, sit there in the chair, far away as possible." And they say to me, "So, Professor, you have a problem?" And I said, "Absolutely, I have a problem." I said, "Are you completely insane? Why do you have that fruitcake going on television and saying 50,000 people will be dying? Not a question of if, but when you have 0 evidence for that?" Because basically, as you well know, as I do, you're getting these numbers from WHO. And WHO is saying, we don't really know how many people die from bird flu. It's not every day we have bird flu in this country, do we? It could be 0 people, or it could be 750,000 people. That's basically the truth. And what your guy did there, he said, whoop, put his hand in there, his finger there, and said, "Let me think, 50,000 dead." Right? And you should not do that. And they're like, "Struck, are you sure?" I say, "Yes, of course I'm sure. This is my area of expertise. I'm a professor of risk communication. I know this area." And what you should have said, I tell them, is A, basically, is that you should go on television and say, we don't even know how many people will die of bird flu. Because people are intelligent, they can understand that. We don't know people die of bird flu. What we'll do now is to establish some kind of, bird flu task force with experts from all over UK or Europe if you want to, and we'll report back on a weekly basis on where we are in terms of bird flu and if it's spreading and if people are dying from it. And if you do that, I said, people will understand that, but people will appreciate that. You cannot have certainty at all times. This is actually an issue of scientific uncertainty. But as long as I said, if you communicate this on a weekly basis, because people are going to be nervous, they will be worried, and they will continue to want to know. It's like when you ask me, the same thing, if you sit in an airplane waiting for takeoff, and you're still waiting and waiting, you want the pilot to tell you, we are waiting, I don't really know why, but I'm looking into it. You want to have somebody to be in charge of that, okay? That's what I told these guys too. That's what I want you guys to do. You make sure basically you communicate on a weekly basis and never again have that fruitcake on television because he didn't know what he was talking about. And then I just walked out and left. I didn't want to shake their head. They were so shocked. And I said, just do what I'm telling you now and you'll be fine. And you know what? They did actually. I was quite pleased with myself at that one. And so that final question on you then. How many people died of bird flu in the UK? 0, not one person. Killed a few turkeys in East Anglia, but no people. That's the whole issue of familiar vis-a-vis non-familiar risk, a very important variable. We also have control vis-a-vis non-control. We want to be in control at all times, and we hate it when we're not in control. So how many of you think you're good drivers? Good drivers? There you go, and this is looking more like it. 80% of you think you're good drivers, according to research from Ola Svensson here at Stockholm University. And basically what happens is when you do not drive, and if you loved one, a lot of people have quarrels in the cars. No, I do with my wife. What happens, basically, you tell your wife or your husband or your boyfriend, girlfriend, you drive too fast, you drive too slow. Why are you in second gear for? Speed up, stop, brake, indicate now. Familiar? Yes, because when we are not driving, we want to become, we're basically backseat drivers. So we're trying to tell that one, this is doing this something wrong. The reason for that is because you trust yourself more driving than you trust your loved one driving, because you want to be in control. That's also one reason why you're more afraid of flying than driving, because when you're flying, you're putting trust into whom? A pilot who you have never met, right? It's a very important variable. Next one is basically high frequency, low consequence risk, vis-a-vis low frequency, high consequence risk. What do we worry more about? Very good. We worry more about low frequency, high consequence risk. We worry about risks that have a high kill sizes, kill many people at one go. And a typical example is the whole issue of airplane accidents, okay? Airplane accidents, what happens is they're very rare. And what happens when they do happen is that, boom, you have like 200 dead just automatically, right? Numbers are big. Car accidents, unless you're Princess Diana, if you die tonight, I'm sorry, you're not going to make Dagens Nyheter. You simply won't do it. But if you fly home tonight and the plane blows up in Arlanda, you'll make the headlines in Dagens Nyheter tomorrow. I can promise you that too. It's very, very true. And so what is happening here is that the media like kill sizes. So for example, what happened? Did I do nothing wrong here now? Oh, there we go. Oh, phew, the guy is on the move. So the media likes basically kill sizes. So for example, if we have the plane and my SAS flight tonight basically blowing up and take off, what's going to happen on the news tonight, Aktuell tonight and Dagens Nyheter tomorrow morning? 204 people dead, front page. Guarantee you. Any bets? No bets. I knew that. Okay, 240 dead. That's the first day. The second day, basically, of those dead, how many were Swedes? They don't care about the Americans or the Indians or the Chinese. We're in Sweden, we care about the Swedes. 120 Swedes were dead. Day 4, of those Swedes, how many were children? We care about kids more than middle-aged men like Ragnar. How many of the kids? Day 5, the pictures of the kids. Then day 7, cause of accident, they've been partying, they had too much, Absolute vodka or something the night before. Okay? That's with plane accidents. Car accidents, people simply don't talk about it. We accept car accidents. We accept people having car injuries and deaths. It's kind of like part of life. So I was giving a talk to the U.S. Federal Aviation Authority, FAA, in Washington, D.C. a couple of years ago. And we were discussing this. Do you know people die in the U.S. on U.S. roads every year? Any idea? 35,000 people dead every single year. Last year was 32,654, I think. So basically, that's a lot of people. So I went to, and I gave a talk to FAA about these various variables, and I asked FAA and said basically, what would happen if we had 35,000 people dead in airplane accidents per year? And the guy looked at me in horror. I said, Professor, that's not a funny question. So I didn't think it was funny either. I'm just a professor. I ask questions, as we do, And so, well, I can tell you, if we had 35,000 people dead on airplanes every year in the United States, airplanes, my friend, would be banned. Now, isn't that interesting? The mode of basically of risk. So we accept 35,000 people dead a year on cars, but not in airplanes. That to me shows how powerful the media actually is. And it's something, now you tell your media friends one thing about suicides. Next point you talked about, starting some kind of campaigns about getting people more aware of the dangers of driving. That's something I understand has been happening here in Sweden, actually. We're getting basically the death rates down in Sweden considerably because what's going on here is Swedish television and a number of newspapers are discussing that we're trying to reduce deaths on roads. And that's something, that message, in my view, should go also to our friends, for example, in Germany or Portugal, where they drive incredibly fast. Very important. Next point, basically, females, males. Who worries more about risks, women or men? Absolutely. Females worry more about risks than men. Now, there's two explanations for this. One is basically the one that I do not subscribe to, so don't say Ragnar says this. It's a Stone Age one, saying basically men are out hunter-gathering and women are home nurturing their babies, right? Which is completely vulgar and wrong, especially in Scandinavia, right? But the one that I do buy into is by Professor Jen Lerner. Jen Lerner is professor at Harvard. And I'll write her name down. Lerner. And she's done a lot of work on emotions. And what she shows basically in terms of emotions, when guys get emotional, guys get very good. Guys get angry. Angry basically is a symbol of what? Risk taking, okay? And women get emotional, what happens to women? They cry, they get upset. They're risk averse. It's the exact opposite. Emotions show that guys get angry and women get upset. And when guys get angry, they get into fights. They take risks. You're not going to have a normal Ragnar's not going to have a fight just walking down the road. But if somebody starts picking on me and starts shoving me and building up this temperature, you know what? I might swing at them. I don't want to. It's totally irrational and stupid. And if you are a risk professor, you do calculations on this. Punching somebody is not really a smart thing to do. In under any circumstances. So female, male is also very, very important. And I'll give you two more. One is also, I haven't written down here. One is fair and not fair. We want to be treated fairly at all times. And that's the same with risks. And the case in point is the siting, for example, of wind farms. If you compare the siting of wind farms, for example, in Wales and Scotland vis-a-vis Sweden and Denmark, okay? Right now, the big plans of Vattenfall, which is owned by the Swedish taxpayer, Swedish state, to build multiple wind farms in Scotland and Wales. Do you think our friends in Scotland and Wales like this? No, they hate it. Why? Because they get no benefits from the wind farms. All they get is the ugliness of these upside-down toilet brushes, but they don't get anything of the benefits for them, so they hate them. And they're worried of risks from them. They're worried basically about the eagles dying and birds hitting them, and it's going to mess up the minds of the sheep and stuff like this. Okay? Although the risks are so tiny, but they still worry about it. How is it in Denmark and Sweden? There, basically, the wind farms are owned by whom? The local municipality. So, for example, where my trees are in southern Sweden, Växjö. So Växjö has its own energy company. They're building their own wind farms for Växjö. And do people like those wind farms? Like, yeah, but the benefits of wind farms go to them. So we can get green energy. So my view on this point is if you want to site a wind farm, wherever you're from, make sure basically the locals get buy-in into it, okay? Then they get benefits for it. Like, if you want to buy, you want to build a new, a runway at Heathrow, which we've been discussing that for the past 20 years, the developers don't get it. I gave a talk to the European developers annual conference at some posh hotel in Munich last year. I said, you guys really don't get it on building a runway at Heathrow. It's very simple, I said. You give the locals some equity. They're like, equity to them? I said, we can't do that. Listen, I'm not saying all the equity. Just give them 10%. You still have some margins, you'll be fine. Just give them 10% because then they will love you. They will like you. We want that. They want ownership. So, we haven't thought about that. So clearly not. And the final point basically is young versus old. Who takes more risks? Okay, and why do young take more risks than old? They're stupid. Well, the young don't know better because they're young, they're invincible. They think, teenagers, when I was 16, what did I do? And don't tell my daughters this, but I basically took a 4x4 Subaru, went to the Mojave Desert at night, and I was driving with my friends in the middle of the night, fast, in dry creek beds. How crazy is that? Hello, it's really stupid, actually. But was it fun? Yeah, I enjoyed it, actually. But I'm not going to tell my daughters I did that because that's a very dangerous thing to do. The similar thing when you start smoking when you're a teenager or when you're 50. Exactly. When you're a teenager, but you're thinking basically, it's fine, I got to start smoking now, and when I'm sick of smoking, let's give it up. But of course, then what happens is that, it's very difficult to give up, and that's the issue. There you go. So based on these findings, regulators and industry took the view that one should develop risk communication programs. Now we know basically, how people perceive risk. Therefore, we can build nuclear power stations, site nuclear waste facilities, build waste incinerators, and convince the public that certain foods are safe. We have the tools, they said. And they basically decided to put three methodologies. One is so-called top-down risk communication. That is basically I stand here on a podium and I talk down to you and say, we should build this nuclear power station here in Uppsala because of A, B, C, and D. And I know you're worried about involuntary risk. I know you're female. I know basically it's not in your control, right? Does top-down risk communication work? Most of the times, no. The second one was so-called dialogue risk communication. So rather than being up the podium, but I can't move now because being filmed, I'd go down and sit next to you and put my arm around you and say, well, let's find a deal here, How about we move your ancestral burial ground from place A to place B? Would that make you, can we find a compromise? Will you accept then that we put this incinerator here? Will you be okay about that? And we build basically a little swing set for your kids? Okay? Dialogue risk communication can work if you trust Ragnar. But it will not work if you think Ragnar is trying to bribe you, okay? And that's the difference. And the third one is so-called bottom-up risk communication. What happens there basically is an issue that starts at the local and becomes national and an international issue. So it starts by, for example, by an NGO, for example, or it starts basically by a group of concerned citizens in a town, and it's ratcheted up the chain completely. And the most famous example of that is basically the Greenpeace occupation of the Brent Spar oil storage vessel in the North Sea in the 1990s. It was seen first as be a local campaign, which should be concerned to the Scots, but it quickly escalated to becoming very much an international campaign. It went from local to national to international to European, almost global. Everybody knew about it. It was a very, very slick campaign done by Greenpeace. So as you probably gathered, and basically risk communication is still very difficult to do. There are a number of key reasons for this. One is, and I already hinted on this earlier, the issue of social amplification and the social attenuation of risk. Some risks are amplified. We discussed this. Murders are amplified, okay? Some risks are attenuated. Suicides are attenuated. But there are also other risks that are attenuated. For example, so-called taboo risks. Depression is attenuated in most countries. We should not discuss about depression because people shouldn't be depressed. We should all be very happy people and not think about suicide or death, anything like that. We should all be happy people, right? Therefore, people did not discuss depression. And also, interesting enough, sexually transmitted diseases are also attenuated by and large in most cultures. For example, I'm going to pick myself now. If I had gonorrhea, would I tell you about it? No, would I? No, of course not. Why not? Why would that help or hinder me in terms of my reputation with you? It would completely hinder it to go down. Why? You think basically, what? He got gonorrhea? He's professor of risk management. How stupid can you be? Why is he not using a condom? First, that's what you think. And secondly, he said he was happily married. So what's he doing? Basically hanging out basically with some prostitutes down, in a red light district in Hamburg or something. What on earth is this man doing? You'd think much less of me. But of course, the problem with this is naturally that I don't know how it is in your areas where you're from, but at least, for example, at King's College in London, my students, there's a growth of chlamydia, okay? So the kids, when they find university, they find alcohol, they find sex, and we have a rising levels of chlamydia. And kids are not talking about it. In that sense, that's something I think I see for our public health bodies. They should look into how can we talk more about STDs and take the taboo out of it so students go and test themselves, right? Is that easy? Never said it was easy. It's difficult, actually. But it's something we need to address in many societies. I mean, there's an outbreak of chlamydia now in some school in Texas, I read in a paper just the other day. In a school where they practice so-called abstinence. Very interesting. The second factor we found in this work was the whole issue of the narrative. What we found out was basically, historically, risk messages were more or less put in numbers. They were saying basically, this risk is small. It's not big, it's a 10 to the minus 6, 10 to the minus 9. People do not understand numbers. People like examples. They like stories. So my view, what you remember, I think, from my talk today is two things. Ragnar breaking his leg in 4 places, and thinking, is that really true? And yes, you want to see it in the break, I can show you my scar. It's very true. But you will think about poor professor, he broke his leg in 4 places. And the second one is basically the bird flu one with my daughter. Why? Because that both narratives, examples, relates to you, yourself, and your children, right? You think about it. Those are 2 examples that will go home with you. More or less, I've done exams on this, people remember them very well. And that's something we should always remember. Put your example, use stories, anecdotes, people like them. And it makes sense if you think about it. When you read, when you put your kids to bed, you don't read them stats manuals, do you? You read them fairy stories, all right? It kind of makes sense. We have a tradition, a 1,000-year-old tradition of reading stories to children, right? That will always continue. But, I'll give you a warning on this, is that when you use examples, then do apple-to-apple comparisons. Do not do apple-to-orange comparisons. So, for example, living next to a nuclear power station is equivalent to smoking 1 cigarette in your lifetime. Why is that a bad example? Why is that a bad example?
It is on.
Yeah.
I was saying that the risk of the power plant is more relating to being exposed to radiation, maybe, and smoking is related to inhaling some
that's a very good point.
substances.
So I agree. So radiation is seen to be much more dangerous than getting some smoke in your lungs, right? Radiation is seen like, wow, being zapped by radiation, you'll get cancer and die immediately. Well, smoking, you don't die immediately, right? That's a very good point. And of course, and also, of course, to that is that smoking is what? Is a voluntary involuntary. Smoking is a voluntary factor, and being forced to be living next to a nuclear power station is what? It's an involuntary one. And we said, Löfstedt, the difference 1,000 times to 1. It's a huge factor of difference. Next issue is whole issue of deliberation. There's a discussion right now in many parts of the world. We should involve the publics more in the siting of waste installations and the like. The problem is basically, will people actually show up? And the issue we have here is so-called self-selection bias. Self-selection bias. So I did a number of years ago, and I'm going to stop at this example. We're going to have lunch in a second here, and then we'll go back to offensive bias and trust. So we're going to be filming after lunch as well. So basically what happened was, a number of years ago, I was working with regard to siting a waste incinerator in the North Black Forest of Germany. We decided to involve as many publics as we possibly could in placing where should we site this waste incinerator, okay? So what we did then basically is that we wrote 4,500 randomly selected Germans from North Black Forest to ask if they wanted to participate once a week, Wednesdays from 7 to 9 p.m. for 6 months, to learn more about waste incinerators and where to basically put them. And then we paid 800 Deutschmarks to do so. Of those 4,500 people we basically went to, how many of those decided or agreed to participate in the process? What do you think? Numbers? All of them? 100. Okay, anybody else? 197. Okay? And do the maths. I don't have them calculated in front of me. It's something like 2 or 3%, a tiny number. Now, what do you think those individuals who decided to participate, they had 3 things in common, okay? I'm going to walk through this now, okay? Were they for or against an incinerator? They were against an incinerator. Were they time poor or time rich? They were time rich. They were basically, they were just students, they were unemployed, they were pensioners, or basically housemen or housewives. And were politically more to the left or more to the right? They were more to the left. They were Greens or SPD. And at that time, Baden-Württemberg was basically a CDU, a conservative stronghold. So the problem of self-selection bias is, do you really want to have communist pensioners deciding where to put your waste incinerators? I frankly don't want that, And that's the issue you need to address. If you're going to use basically deliberation, how can we ensure to get people like you and me participating? So I can tell you, I don't participate. If you're going to build some kind of, telephone, mobile telephone base station up the road from me, do you think I'm going to go and sit in some yucky meeting for a couple of hours? No, I'm tired. I've been traveling all week. I'll go home and see my wife, have a glass of wine, discuss, basically ask what the kids are doing and discuss my week and how lovely you guys were, right? That's what most of us do. We do not want to participate. And that's a big problem with deliberation. And then what we're going to do is basically a case study. It'll be a Swedish food scares case study. And for this case study, you'll be divided up in 3 groups of 10 individuals each, and which one group will be here, one over there, and one downstairs in the lobby. And we'll go through basically more or less to 4 o'clock or something like that. And we'll do a wrap up until 4:15 when I have to go to the airport and fly back to London for my next talk tomorrow. I hope that's okay for you guys. So what we're going to do basically in terms of coffees is that you can have coffee when you're working on your case study, all right? So we're not going to have a designated coffee break. You want to maximize Ragnar time, okay? That's the crucial factor here. So we discussed deliberation. We discussed the whole issue of self-selection bias. Another important issue was the whole issue of optimistically biased. As we discussed briefly, is that most of us have been programmed to be optimistically biased. It'd be horrible to think that we're all pessimists, right? Pessimists make me always fall over and break my leg here, right? That's being pessimistic. And we've been programmed to optimistically biased, and therefore as a result, people therefore drink and smoke, as we discussed. And also young people are more optimistic than older ones, because the older ones we learn from our past mistakes. The most important variable of all is actually trust and not trust. Trust can explain up to 50% of how the public perceive risk. There's a direct correlation between high levels of public trust and low levels of public perceived risk, right? If you have a lot of trust in a system, then the people are willing basically to take a further risk. And vice versa. If there's a low levels of trust in the system or in the industry, then people are not willing to take any risk or much less risk. So for example, if you trust a nuclear operator in Sweden, then you're willing to consider having a house close by to the operator, right? Well, this guy's cool. He's honest to me. He's being transparent. I believe I can trust this individual. Therefore, I can settle in this community. If you think that this industry in question is trying to basically, poison you, is putting down chemicals down the well, is not telling you the truth, is lying, then of course what happens is that you're not willing to trust that person. You're not willing to basically take a risk with them. And this can explain up to 50% of people perceive risk. It's absolutely huge. Of all the variables I've spoken so far, trust is by far the most important one. The crucial thing about trust is it can be destroyed in an instant, right? Trust is like marriage, for example. If you're unfaithful and you're found out, will your partner ever trust you ever again to the same degree? No. Why not? Well, because you're basically being unfaithful. Duh, it's pretty obvious. And same thing, basically, if you lie to someone, then it's very difficult to rebuild that trust afterwards. So my advice to you, by the way, is don't lie, okay? Just don't lie. Even if you don't know the answer, then just tell people you don't know the answer. The worst thing to do is to go to the audience and you get a question you cannot answer to, and you're embarrassed by that, and make something up. you can be completely killed. I tell my students this. You're basically BSing, you say in American. You're BSing here. Don't BS me. I'm a professor. You're a student, okay? Just tell me what you know and what you don't know, and I'll try to fill in the blanks for you. And even us academics get things wrong too. And I'll tell you what I don't know. But it's better to be honest than to lie to you, okay? So trust is by far the most important variable. The second variable, the next important is that of basically voluntary risk, the factor of basically 1,000 to 1. And other ones then follow along after that. And what I find interesting is that in many cases with regard to trust, is that some companies who don't have trust, they think they can communicate and regain that trust. And I tell these companies, don't bother. You're wasting your time because people still not believe you no matter what you say because you're not trusted. Try to work with other neutral third parties to regain that trust. I'll give you one case study. Austrians, they don't like GMO foods, genetically modified organism foods, and they don't like waste incinerators, okay? It's funny. The Swedes love waste incinerators. We actually import waste to Sweden to burn in Sweden. So the Germans send wood waste. So basically we send, it's very funny. So we cut down Ragnar's trees, okay? We chop them into lumber and paper, and the lumber goes to Germany to build Berlin, all right? So they pay to basically take wood from Ragnar. I like this, it's very good for my pension, okay? So the wood goes to Germany, and when they finish building the houses, they have wood residue. And that's basically goes back to Sweden, and the Germans pay for that too. Please take our residue back, because we don't want to burn it in Germany. Same thing for Austria. They don't like incinerators either. So the Swedes like it, the Austrians don't. And a number of years ago, we had a problem in the city of Vienna. The city of Vienna wanted to build an incinerator because the city of Vienna knew they simply cannot go on with putting it in landfill. We were running out of landfill space. And they were scratching their heads and thinking, how on earth are we going to get permission to build an incinerator in Vienna? Everybody hates it. And then basically they realized, smartly, there's no point for them to communicate about it because no one would believe the city of Vienna because they had a vested interest, right, in building an incinerator. And what happened was, I need a glass of water actually. Can somebody give me a glass of water? I can't move. I'm not allowed to move. Thank you. So what happened basically was, one bright spark in the city there said, we need to find somebody that's highly trusted to communicate on our behalf. That's awfully kind. Thank you so much. Thank you. And we need to find somebody that's highly trusted. And they looked around and they picked an artist. That artist's name is Hundertwasser. Does anyone know Hundertwasser? Exactly, Hundertwasser is the name of a painter from Austria. And he's now dead, unfortunately, but he's one of these very quirky painters. He's a bit of a hippie kind of guy. He makes basically eclectic housing. Like he puts plants, trees on houses. The houses inside are not round, they're rounded, not basically square shaped. He's very much of an alternative designer. Very famous guy. So they approached him and said, listen, Hundertwasser, we have a problem. No one trusts us, but they love you. You're a national icon. And we want to build an incinerator here in Vienna. And we want you to help us. And the guy looked at them strangely and said, me? Help? Well, I don't know anything about incinerators, he said. I know nothing about incinerators. I'm your humble little painter, he said. And he said basically, then they said, well, please, Hundertwasser, you need to help us. We are desperate. We cannot go to landfill anymore. And then he said, okay, fine. I'm willing to talk to you. You have to persuade me that incineration is the way forward, okay? And basically, if you can't persuade me, then I'll buy into it. And if you fail, then I will not buy into it. And he said, okay, step one is complete success. And then they brought in all these different scientists, from all over Vienna and some from Germany. And they basically bombarded the poor guy with incineration material and why he should go for an incinerator. After 6 months, this guy was probably so exhausted. After 6 months, he said, okay, I'll give up. Fine, I will support an incinerator in Vienna. But he said on one condition. And all the folks in the city, they're saying, oh, one condition? Why not? We're exhausted. It's been 6 months. And he said, the condition is, I want to design the outside of the incinerator. I won't touch the inside. I won't touch basically the boilers and stuff, but I want to design the outside. And they were so relaxed. I said, of course, Hundertwasser, you can design the outside. And then he went out publicly and said, basically, I support an incinerator for Vienna. I think it's the best thing possible. We're going to do it. And they built an incinerator. There were no protests on it. And he got the design around it. He put trees on top of the incinerator, a little quirky little chimney to it. And you know what today? That incinerator, my friends, is now a tourist attraction. Now, how cool is that? So one lesson to you, if you basically work in an area where you're not trusted, being a regulator or industry or whatever, is you need to find a neutral third party to support you. I don't know who that would be in Sweden. Would that be Peter Forsberg, the famous ice hockey player, maybe? I mean, he's very famous. He scored that wonder goal in sudden death overtime against Canada, which we discussed over lunch. It could be Forsberg. And it could be, in Canada, probably Wayne Gretzky, for example, the famous ice hockey player in Canada, for example. Think about who that neutral third party could be to support your cause. That's something I find very, very important. Making friends, having allies at all times. Okay, we're going to skip this slide. There have been a number of failures and successes. We know that. We've got to work hard to have success. So basically, why is all this important for the pharmaceutical sector? Pharmaceuticals are developed by the distrusted pharma industry. We know that. And it's being attacked continuously. For example, that's from the food talk. Too much salt, too much fat, too many calories. That's for food, not for pharmaceuticals. But you guys are still being very much attacked anyways. Pharma scares are amplified by the media. We saw, for example, that clearly with Vioxx in 2002. We saw it again with Avandia. We saw it again basically with, was it Tamiflu or something in the press last year? There's a lot of discussion, especially in some newspapers. In the UK, I'd say the Daily Mail especially is very, very aggressive on this. There's a strong pharma-children link. That's one thing we see constantly with regard to discussions, is basically if a risk affects kids, that's much more amplified, much more discussed. If that risk affects older middle-aged men like Ragnar. The reason, of course, that being is that kids are the future, and Ragnar is past his sell-by date. There's a scale effect. Many individuals are exposed to certain pharmaceuticals at the same time because people are taking them. And many of the risk factors are highly relevant to the pharma sector. So the factors I discussed before. Because pharma drugs, for example, they're what? They seem to be technical. Guy in white coats producing them. They basically they affect females, they affect kids, they are unfamiliar, etc., 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 non-controllable. If you look at those initial factors and you compare them to the areas you work in, you will see a direct correlation. So what can we do about it going forward? I think there are a number of things we can do with regard to the whole area of risk communication and broader pharmacovigilance area. One is to promote media communication guidelines, a lot of ones that I did for BBC or with BBC, or the ones that Harvard International Food Information Council produced, is to ensure that media become better communicators of risk, science, and uncertainty. I think the media in many cases are bad communicators. And to be clear here is basically, we should be working with the media. Okay? We should not be frightened of the media. Sometimes I get these talks and folks say, well, the media is just horrible. I was misquoted. Yes, I have also been misquoted. But it's better to be misquoted than not quoted at all. Okay? By ignoring the media, you don't get any quotes. But if you talk to them, you can be quoted. And furthermore, by speaking to the media, you can basically help them get the stories right. I make the point that I reach out to BBC, Wall Street Journal Europe, and Financial Times about an average once every 2 or 3 months. I just have a coffee with them or a glass of wine and discuss basically the work that I'm doing with regard to evidence-based policy making in Europe or whatever. And in so doing, you make friends with them. I remember vividly a couple years ago, I got a phone call from basically a journalist doing the 10 o'clock evening television news. And he said, Professor, we're thinking basically of running a story about chemical X at the 10 p.m. news tonight. But we don't know if this is a real story or a make-up quack story. We don't know if it's true or not. Do you? And it's quite cute. I'm not a chemist. I've got a clue. And I told him basically, I don't know the answer to that, but give me 2 hours and I'll find out. So what I did then is afterwards, I made a few phone calls to my friends at Oxford and Cambridge and Harvard and whatever, and to find out, to get a clear situation about this chemical. And I called back. And by the way, if a journalist calls you, promise me you always call them back. You want to keep that trust line. So you do. So I called them back within 2 hours and said, basically, I've looked into this, and what I found, more or less, this story is quack. Do not run this chemical on a 10 p.m. news. And by the way, I said, do not trust me. Trust so-and-so, and I gave the person's name, and because this guy is a Nobel Prize winner in chemistry. What happened then? That story was dead. It did not run at a 10 p.m. news. And if that's what happens when you make friends with the media. Especially these days, the media are highly stressed out. They're getting fewer and fewer far between. They want to ensure the stories are accurate. They want to get them right. And here, basically, I'm more than happy to. With BBC over years, I've done a number of talks with them, and BBC developed some media guidelines, which I was the peer reviewer of, which I think could be of interest to this audience. So what I'll do, Anna, is I'll send those guidelines to you, and you can forward them to the whole group, and you'll get them probably Friday night. Second point, find more neutral, trusted third parties to speak on the sector's behalf. Find people like Hundertwasser in your community. Help regulators and policymakers become better communicators. I find very interesting, in many cases, regulators and policymakers are not good communicators themselves. They don't want to communicate. Regulators want to do what? They want to regulate. They want to make laws. They want to pass laws. They're passionate about protecting consumers, protecting the environment. But they don't want to communicate. And as a result, many of them are bad communicators. They're nervous and stuff like this. And this is something I feel, too, that we in the academic community should help regulators to become better communicators. But also, we should ensure that scientists themselves become more honest communicators. I think, basically, in many cases, especially in the UK, I cannot speak how it is in Sweden on this, is that the scientists it's a lot of competition between scientists, okay, right? A. B, increasingly we have more and more support staff at universities. In some universities in the UK, 50% of the staff at universities are not academics, they're support staff. So there are a lot of people running around wanting to do something, eating Ragnar's overhead, okay? And these support staff, they love basically getting nice, big, juicy headlines from somebody's research article. And I tell scientists, you make sure that those juicy lines coming out from the PR department at university are true to what you said in your article. Because if they're not, you're causing unfair, unnecessary, and bad amplification of a story. And it's bad for science, and it's bad for you. Because again and again and again, I see these PR lines coming out in the press, this story says this will cure cancer. And there was nothing at all that in the article. That's the PR people trying to get more publicity to get, justify the salary, of course, and to help this academic. Furthermore, in my view, we should promote the establishment of a genuine European Academy of Sciences. Okay, we have at the moment 2 European Academy of Sciences, one based in Salzburg and one based in London. But they are not genuine. They're basically what happens there, once a professor retires, he gets an honorary membership of this group. That's not what I call a proper working European Academy of Sciences. What I'm looking here for is to have the same kind of academy as we have in the United States. The National Research Council or IOM, Institute of Medicine, for example. These are real academies of science. And finally, we should help evidence-based regulators such as EMA and MHRA establish independent risk communication advisory boards, similar to the one that FDA already has in place, was very ably chaired for the first 4 years by Professor Baruch Fischoff, my mentor at Carnegie Mellon University. This is something that I'm pushing also here in Sweden and the like, that we should ensure that every message that are being put out by the regulators have been pre-tested and actually work. We should help ensure that food and pharma regulators and other bodies pre-test their communication messages. You have to pre-test them. Otherwise, you will not know how the publics and patients will react to them. We should support the establishment of a formal working group on the risk in the European Parliament. This is something I've been working on for many years now. And it's something that probably is likely to happen with the work of Julie Girling. Julie Girling is a UK Conservative MEP, and she's leading this effort right now in Brussels. And finally, we should ensure that communication director within a regulatory agency is part of the executive function. That comms director should not be outside the tent. That comms person should be inside the tent, working with the other main individuals of that agency to ensure basically that they have the right comm strategy going forward. On that note, I'll say thank you very much. That's it.